Coordinator with the Detroit Regional Chamber. Thank you for joining this session. The Chamber launched a series of webinars to help businesses across the state prepare to restart operations and return to work. I would like to thank our guest speaker, Jennifer Young, Compliance Director, Account Executive for J.S. Clark Agency, for volunteering her time to share her expertise. Before we get started, I want to make sure that you're aware that all participants are on mute, but you do have the option to submit questions directly to the speaker through the GoToWebinar control panel. I will now turn the webinar over to Jennifer Young.
Well, thank you very much, Kimberly. I really appreciate the introduction. Thank you for everyone joining us today. I hope that everyone is healthy and doing well. For my session today, we're going to be talking about navigating employer and employee impacts of COVID-19 and how that directly impacts employee benefits, as well as the regulatory actions that the departments have taken with new requirements and options available to us as benefit administrators. As we start talking through our session today, when I talk about a furloughed employee, I'm defining that as an employee that is on temporary leave. They are still considered an employee whether they have a reduction of hours or no hours. They're fully expected to return to work. You're continuing benefits for them, whether that be paid or unpaid. And employees do have PTO available. For employees that have been laid off, they're terminated, they're not expected to return to work, and any benefit continuation will be strictly based on the contracts that are in place, and in most circumstances, an offer of COBRA will be made. When it comes to group health plan eligibility, right now, it is super, super important that all employers update their employee handbook. You want to make sure that your leave of absence policies are up to date. This is a great time to add emergency leave policies, or what we would call a pandemic policy, into your leave of absence policy. You want to make sure that your standard leave policies are up to date and that you're addressing what happens with employees when they're on furlough or layoff, and whether that is paid or not, how benefits are going to continue, what will the contribution requirements be, what are our waiting periods when we recall and reinstate employees, do we need to modify our summary plan descriptions and issue SMMs, and that we're clearly communicating all of this with our employees. At J.S. Clark Agency, we're monitoring 56 carriers with provisions that they are taking during COVID-19 with regard to how are they going to treat furloughed employees, how long they're going to allow coverage to continue for our furloughed employees. Are they requiring waiting periods when we're recalling these employees? What are their grace periods? Some carriers are extending grace periods. And so we're tracking all of this. And we have a link included here for you where you can actually see each of the carriers detailed on our coronavirus website. As you can see here, for medical, dental, and vision, every carrier has very specific requirements. So you want to make sure that you check that what you're doing with your employees is in line with what the carriers will allow. Now, when it comes to life and disability, we're looking at even more things. In addition to, are we allowing coverage during furlough and how long, and waiting periods, we also want to know if they're going to invoke new evidence of insurability requirements and pre-existing condition clauses in the contracts for these recalled employees. I've been getting asked a lot of questions on claim eligibility. So each carrier has their own position, again, with regard to, I have employees on furlough. If they become disabled, is the carrier going to consider them actively at work? These are all things that we want to be thinking of and making sure that we're keeping up on. I've been asked a lot, if my employee is on quarantine, would that be eligible for disability? And in almost 100% of the cases, that is not a qualifying disability for your disability contracts. There actually has to be a diagnosis. So if you have an employee that it has actually been diagnosed with COVID-19, then I would encourage you to complete an STD claim form. You also want to look at your contracts with the insurance carriers to make sure a reduction in hours doesn't remove eligibility. And if you're terminating people, putting them on permanent layoff, that you're providing the life insurance conversion notices. It's super important. There's been so many lawsuits over an employer not providing a conversion notice for life insurance. Then you want to decide how you're going to handle contributions during leave. If you're putting employees on paid leave, it's super easy. You're just continuing pre-tax contributions. Now, most employers will set up their unpaid leave policy to mirror what they have for unpaid FMLA, where you can prepay contributions. Those can be done on a pre-tax basis. They can't span 2 plan years because of deferred compensation rules, can't be the only option offered, and cannot be required. You can also allow employees to pay as you go. So that's going to be post-tax contributions, and you can run those with standard payroll or monthly. I always recommend running that monthly, so just easier for administration. Then you can allow catch-up contributions. So the employee returns from furlough, you can do catch-up contributions on a pre-tax basis. Catch-up contributions can span 2 plan years, but as an employer, you have a risk of recovery if the employee doesn't return to work when they're recalled from the furlough. The one thing you really want to keep in mind when it comes to how you structure your contributions while employees are on furlough is do not discriminate. Do not favor any employees over another. If you're going to allow catch-up contributions, you allow it for everybody. You don't just pick your favorite people and say you can get catch-up contributions, but everybody else has to pay as you go, okay? A lot of employers during this time are giving employees reduced contributions and waiving contributions because it's been such a hard time. Oops. There we go. Now, if employees are going on unpaid leave, keep in mind you can't require that they continue coverage for a period of unpaid leave. If you do require coverage continue, then you must allow catch-up contributions, and you can do that without the employee's approval. If you're going to terminate an employee because they're not making their contributions while they're on leave, you want to make sure that you give those employees the same grace period that you have to pay the insurance carrier for their contributions. So standardly, we have 30-day grace periods, but right now, a lot of the insurance carriers are allowing 60 or even a 90-day grace period. And you want to make sure employees on furlough are given the same grace period that you are as the employer during this time. If you're terminating coverage, you want to make sure that the employee that you're terminating gets a 15-day advance written notice. And if they don't make their contributions while they're on furlough, it's not a qualifying event for COBRA. When it comes to our health FSAs, we have options available to us. You can allow employees make post-tax contributions on an as-you-go basis. You can suspend or terminate their FSA so they wouldn't have any contributions and no eligible claims. You can suspend their contributions and allow catch-up contributions, so you would be making those contributions for them. But if you do that, you want to make sure that your contributions don't go over $500 because that will disrupt your accepted benefit status for the FSA. There are risks with catch-up contributions in the FSA because of the uniform coverage rules. And you can change your active at work requirements. You can say you must be actively at work to participate in the FSA. You can require employees reinstate when they return and make either lump sum or catch-up contributions. And you can limit re-entry to the beginning of the next plan year. But all of those changes would require a change to your summary plan description. Also keep in mind, when an employee terminates their FSA, it may be subject to COBRA if the FSA is underspent. And most administrators are expecting forfeiture reports, usually come out in July. Those are most likely going to be delayed for this year. Now, for those of you subject to the ACA, you're subject to an employer shared responsibility under the ACA. There's 2 different options that we have available to us. One is you're using the monthly measurement period. It's the least common method used because under the monthly measurement period, it does require that you're offering coverage on a prospective basis, not a retroactive basis, with the assumption that the employee is going to work full-time for the month. If you're using the monthly measurement method, then it's when the employee returns to work, they work 1 hour, you're offering coverage no later than the first of the month. Averaging rules don't apply under the monthly measurement method, so we're not counting periods of FMLA, USERRA, or jury duty. But rules of parity, continuing employee, and the 13-week break in service rules do apply. When we're using the look-back method, which is the most common method, we're measuring employees for a period of 3 to 12 months and offering coverage to eligible employees for a period between 6 and 12 months, with 12 months being the most common. Averaging rules do apply under the look-back method, so we are counting FMLA, USERRA, and jury duty, and the rule of parity, continuing employee, and 13-week break in service rules apply as well. So just as a reminder, the rule of parity states that if the number of weeks worked is more, at least 4 weeks, and the amount of time that the employee has a break in service is longer than the amount of time that they worked immediately prior to the break, that they can be treated as a new hire when they return and start a new measurement period. The 13 break rule is this exact same thing. If the employee doesn't have at least 1 hour for 13 weeks, 26 weeks for an educational facility, then you can, when they return, you can treat them as a new hire and begin a new measurement period. So under the measurement, look-back measurement period, when an employee returns to work and they're in a stability period, when they're recalled, they're going to continue that same stability period. No waiting period is going to apply unless you have the rule of parity or the 13-week rule in place. So employees that waived coverage for their stability period, when they come back, you don't have to make them offer coverage, and then you just continue measuring. This helps you avoid any penalties under the ACA. I've been getting asked this question a lot. What do we do when we're subject to ACA and we have employees that are transferring from full-time to part-time, especially with reductions of hours right now? So when you have an employee transfer from full-time to part-time and they're an ongoing employee, which simply means that they've completed their initial measurement period, you're going to apply the look-back method as of the date of the status change and include all the hours worked in the first position. At the end of the measurement period, if they don't average 30 hours or more, then you can terminate their coverage and offer COBRA due to the reduction in hours. There's an option available as well. This isn't used very much because it's a little bit more cumbersome to administer, but if you have an employee going from full-time to what we call a true part-time position, not just a reduction in hours, what you can do is if coverage was offered no later than the first of the 4th month that the employee was employed, you can terminate coverage the first of the 4th month following the date that the employee had the change in status. And then you're going to use the monthly measurement period for the rest of the measurement period in that current period. And again, not simply a reduction of hours. We really only recommend this if somebody's truly going from a full-time position to a part-time position. Also under the ACA, a lot of employers get nervous about penalties because the penalties can be substantial. So under the Part A penalty, you need to be offering coverage to 95% of your full-time active employees. So these employees that are going on furlough, they're still considered active employees. That can reduce you to under 95% of covered if you're not continuing coverage during the period of furlough. And then an employee goes into the marketplace and gets a subsidy, you can get hit with the penalty. Likewise, on the Part B penalty, that applies to minimum affordable coverage. So for 2020, the minimum affordable coverage is defined as 9.78% of household income, which employers, we can't determine that as employers. So we have 3 safe harbors that we can use. We can use the FPL, which for 2020 is $101.79 of the lowest cost single option available on your plans. Rate of pay is the second most common one used, and the W-2. The W-2 isn't used very often as a safe harbor because you can't make retroactive adjustments to contributions. So to make sure that you're compliant, a lot of employers are either waiving or reducing contributions for these people while they're on furlough. Next thing that we have going on that I get asked a lot of questions about is insurance carrier premium credits. So the insurance carriers have been very generous by issuing premium credits. We've gotten it a lot with medical, dental, and vision. And then they're like, they come to me and they say, hey, I just want to keep this. You know, we're all having a hard time. Can't I just keep the money? Well, before you determine what you're going to do with those premium credits, is look to your summary plan description, because we have ERISA requirements. So in your summary plan description, there'll be a paragraph in there that describes what you're going to do with premium credits and MLR rebates. So even though these premium credits aren't true MLR rebates, you want to look to that SPD. Obviously, if you as the employer are paying 100% of premium, you don't have to share it with the employees. If the employees have voluntary dental or vision, let's say, they're paying 100% of the premium, you want to make sure that you do not retain any of those funds and you're distributing 100% of the credit back to the employees. And you can do that in the form of issuing a check or contribution holidays. If it's a de minimis amount, you can document what you're doing with that and apply it to enhance benefits or reduce contributions for the next plan year. If you're sharing contributions, you're paying a portion of the premium and the employee's contributions and a portion of the premium. You want to make sure that you allocate according to those percentage and share it back to the employees. Again, you can issue a check, you can give a premium holiday or suspended contributions. And again, if it's a de minimis amount, hang on to it, use it to offset contributions, and enhance benefits next year. Oh, we're just talking about this. I can't believe open enrollment for the majority of the employers is right upon us. During all these crazy times, I would suggest that we allow for extra time during open enrollment. Decide how we're going to do our distribution models. Do we have employees working remotely? Do we have employees on furlough? How are we going to communicate with them? Are we administering benefits online? Direct mailings? Are we going to do virtual meetings? Do we have employees reporting to the workplace? And then make sure that you don't forget about your COBRA participants, because they're all entitled to open enrollment as well. Now, COVID-19 benefits, all of our group health plans must cover COVID-19 testing without cost sharing, without prior authorization, and without medical management. And that's going to be all of the testing and the associated office visit, urgent care visit, or emergency room visit as well. When the CDC recommendations come out for a vaccine, coverage for the vaccines without cost sharing will be 15 days after the CDC recommendation is received. Now, with regard to the carriers and COVID-19 testing, their testing without cost sharing is through the end of the national pandemic. Right now, the end of the national pandemic is expected to expire October 23rd, but they can extend that at any time based on what's going on when October gets here. They must be medically necessary. They must be ordered by a healthcare provider. They're not going to cover testing for return to work testing, occupational testing, if the kids need to be tested to go to school, or any vendor testing. The CDC is recommending that employers not require return to work testing. They feel that it might be difficult for an employee who had COVID to get another COVID test when they're not experiencing or displaying any symptoms. So the CDC guidelines, they feel that they're comfortable with having the employees come in, fill out their form, take their temperature, wear masks, use hand sanitizer, do social distancing. There are special considerations for nursing homes, and those are governed by the Michigan Department of Health and Human Services. If you need additional information about that, you can find them on the link here. So the departments did get together, and the DOL gave us all the rules on how we have to administer the Families First Coronavirus Response Act, or the FFCRA. This has two components. One is emergency FMLA, where employers with 200 to 500 employees on the date leave is requested have to provide EMFLA leave to employees who have been there 30 days or more, because they can't send the kids to school or daycare. So that's up to 12 weeks of leave. The first 10 days can be unpaid unless they qualify for EPSLA, which we'll talk about in a second. And then 10 weeks of paid leave capped at 2/3 of their weekly pay, up to $200 per day. It's important to note, employees that are on furlough or layoff are not eligible for this leave. And this provision sunsets December 31st. The second portion to this is the Emergency Paid Sick Leave Act. Again, it applies to employers with 200 to 500 employees. And when an employee misses work for a COVID-related quarantine, isolation order, doctor telling them to self-quarantine, or they're experiencing COVID symptoms, they're entitled up to 80 hours of paid leave at 100% of pay, up to $511 per day. If an employee misses work for a COVID-related reason to care for another person in their home, where they're under quarantine or advised to self-quarantine, or the kids can't get to school, or anything else that the HHS prescribes, the employees are entitled to the 80 hours at 2/3 of pay, capped at $200 a day. Again, if they're on layoff or furlough, they're not eligible for these benefits. This also sunsets on 12/31, and the EFMLA and the EPSLA are tax deductible events for employers. So back in May, the IRS issued two notices, Notice 2020-29 and 2020-33, that gives us additional flexibility inside our Section 125 plans, extends deadlines to submit claims, clarifies COVID treatment under high deductible health plans, and for those of us with carryover provision, it increases our carryover maximum from $500 to $550, and that's going to be indexed as we move forward each year. Now, under Notice 2029, this allows us to make an amendment to our Section 125 plan that will allow participants to make a change under the plan without a qualifying event. Now, if we do this, we want to make sure that we're working carefully with the carriers, and the carriers agree to allow you to hold basically an open enrollment period. So you can allow employees who waived to enroll in the plan, change coverage options. Maybe you offer a PPO and an HMO. You want employees to have the opportunity to move to a lower cost plan for them. Change coverage tiers. Maybe they want to add or remove dependents, or maybe they want to waive coverage and go on their spouse's plan. And if you do that, attestation is required. The IRS gave us a sample. It's super simple. It just says the employee's name, and I am enrolled or immediately enrolling in one of these 7 options, and you just want to keep it with the employee file. Oops. Oops, sorry, I went too far. Okay, now on the FSA, LPFSA, DCAP side, they're saying that we can allow open enrollment without a qualifying event. It's optional, you don't have to do it, but if you want to amend your 125 plan, you want to make sure you update your SPD or issue an SMM for this temporary period under COVID. Those amendments need to be completed no later than December of 2021. All contributions need to be made on a pre-tax basis prospectively based on the number of pays left in the year. There's a temporary extension of the claims period that's available as well. If you decided to adopt this, what it would do was it would extend non-calendar plan years that end in 2020 or a plan with a grace period provision that ends in 2020 to extend eligibility for claims all the way through December 31st of this year. It's not available to plans that have a plan end date after October 31st. It's not available to calendar year plans because they're already covered through 12/31 and no extension to 2021. It's a temporary provision that we can allow for our employees to do adjustments in their contributions. So if we adopt this, what you could do is allow employees to enroll or waive coverage under their FSA, LPFSA, or DCAP. Contributions aren't returned nor reimbursed to employees if they waive. If you allow employees to increase or decrease contributions, you can do that as well. But if contributions are decreased, they can't decrease past amounts already reimbursed nor contributed to the plans. For our dependent care, if you haven't already, I really strongly advise that you adopt a grace period provision. Employers aren't at risk for lost funds inside of dependent care. And with everything that's gone on with COVID, a lot of employees already have had a qualifying event so that they could stop contributions, but they might have $2,500 sitting out in their DCAP and that they were going to use for daycare or summer camp that's not available to them now. What you can do is adopt the grace period so that they have the first 2.5 months of next year to incur and submit claims to access those funds. They do have to be employed on the last day of the year. Another provision that you can adopt to help out employees with DCAP funds sitting there is putting a spend down provision on your plan. And what this will allow is employees that have been terminated can continue to incur and submit claims through the end of the plan year so that they're have some measure of relief to access their funds. For our high deductible health plans, I think everybody already knows this. We can still make HSA contributions, even though they're covering COVID testing and treatment, first $1 right now. But that provision, I just want to remind you, does sunset on December 31st. They haven't done anything to extend this into 2021 yet. So back in March, the departments got together and issued a joint rule that was effective March 1st that affects how we administer HIPAA, COBRA, and ERISA. So two key terms here is the national emergency, which is expected to end October 23rd at this point. And then we have the outbreak period, which is 60 days after the end of the national emergency. So we really don't know what the true end date is going to be for this outbreak period because they've already extended the national emergency once and it's expected to be extended again. So under HIPAA, I think all of us already know that under HIPAA, if my employees get married, have a birth of a new baby or adopt, or a loss of other group coverage, they can come to us within 30 days and that's timely enrollment to change the elections under their plan. 60 days for CHIP or Medicaid. What this new rule did is basically said March 1st, the clock completely stops ticking until after the end of the national emergency. So if you have an employee, let's say that comes to you and they have a new baby on March 1st, if the national emergency ends October 23rd, that means the outbreak period ends December 22nd. That means that the new baby can be added retroactive to March 1st of this year, all the way up until January 21st of 2021. And as administrators, this is something that we're not accustomed to accommodating. Now, it's certainly an extreme example, but I could see where an employee comes to you 60 or 90 days after they got married and say, oh my gosh, I forgot to add my spouse. Then you would, under this rule, you would have to allow the employee to add the spouse. The coverage would be retroactive, but keep in mind under Section 125 rules, that retroactive coverage for the employee to add their spouse has to be post-tax contributions, pre-tax moving forward. The only time the IRS will allow retroactive pre-tax contributions is when we have a new baby. And this is going to apply to all of our COBRA participants as well. So on COBRA, they pretty much did the same thing. We all know a qualifying event happens, we have 60 days to elect COBRA, 45 days to pay for COBRA. Effective March 1st, the clock completely stops. So if somebody had a COBRA payment due on February 15th, and then they had 15 days to March 1st to make that payment and didn't, the clock stops ticking completely, and they can get retroactive reinstatement of our continuation of coverage for that payment all the way until the end of the outbreak period. So if an employee terminates May 4th, national emergency ends October 23rd, outbreak period is then December 22nd, a qualified beneficiary can elect COBRA retroactive all the way up until February 20th of 2021 with no COBRA premium due until April 6th of 2021. Okay, so now this is an extreme example again, but I can certainly see where people would be smart enough to play the COBRA game. And by that I mean, let's say they got married. They don't add their spouse to COBRA because they're waiting to see if they're going to have incurred claims. If the spouse has something bad happen, they can add the spouse on retroactive to the date of marriage and then receive all of the benefits they need. So this also applies to all ERISA plans. Under ERISA, we have 365 days to file a claim, 180 days to appeal, and 4 months from the denial to file an internal claim denial. This is all clock stops, and we have extensions on this. I think how it's going to impact people most is if you have a 2019 plan year for your FSA with a grace period, that grace period is affected by this, where employees can continue to submit eligible expenses from 2019. I know everybody already knows this. We can do over-the-counter without a prescription, great pre-ACA rules. We can cover menstrual products now. It doesn't have a sunset provision. It can go retroactive to 1/1. But the one thing I want to mention is you may need to adjust your SPD. If your SPD says that you're going to cover over-the-counter medicines, and it requires a prescription, you want to make sure that you issue the amendment to your SPD. If your SPD stands moot and says that you're going to cover all IRS allowed expenses, then you don't need to amend your SPD. Just a few regulatory reminders. We have new COBRA notices that were issued in May, new marketplace notices that were issued in June. The DOL gave us new FMLA forms in July. MLR rebates are going to be coming soon. They are a little delayed because of the national emergency. We got new CHIP notices in July. Our Medicare credible coverage notices are due out in October. We do have new SBCs beginning for plan years starting January 2021. On ACA reporting, a lot of people have been asking me, are they going to change the forms? And they did change it, but it's only to accommodate ICRAs, which is individual coverage HRAs, a new product that's getting a little bit of attention. And the PCORI fee was reinstated. So just a reminder, it was originally set to sunset on October 2019. They extended that to 2029. I do want to point out I'm following legislation, always following legislation. This is one I have been waiting for a long time. So the Medicare Enrollment Protection Act will create an open enrollment event for those transitioning in and out of COBRA that are Medicare eligible. So hopefully the House and the Senate will get this passed. It just got pushed up to the House. On November 10th, the Supreme Court is going to determine the constitutionality of the ACA for the third time. This is the case of California versus Texas. Basically, our country is split 50-50 on this. And it's all tied to the repeal of the individual mandate. So they're saying now that the individual mandate is gone, all of the ACA should be invalidated. We probably won't get an answer on that until next summer. And then, of course, we have the election coming up in what, 49, 48 days, something like that. It's coming up really fast. So everybody's asking me, wow, what's going to happen with our health care? Well, it's going to largely be determined on the outcome of the election. Back when the ACA was passed, we had Obama, Democratic president. We had Democratic majority in the Senate and the House. The way we sit in the 116th Congress, the House has Democratic majority, the Senate has Republican majority. And as long as the Houses don't have mutual majority, we're not going to see anything happen. Regardless who is president and the changes they want to make, as long as we have a split majority between the House and the Senate, we're just not going to see a whole lot of movement and a whole lot of change. So I have a freebie for you guys. Anybody who wants to reach out and contact JS Clark Agency. We have 2 forms packages that were prepared by our ERISA attorney on retainer, Larry Grudzian. You may have heard of him. He's very well known and speaks often. We have the coronavirus employer compliance forms package, which does include all of the necessary forms and policies to administer under the FFCRA. And we have the employer reopening forms package. Both of these are very comprehensive. We're more than happy to provide them to you. All you need to do is contact us. So benefits during the pandemic. When in doubt, just reach out to us at JS Clark. We have an amazing staff of executives that are ready, willing, and able to help you with anything that you need. And this is our contact information. Up here in the corner, you can click here to visit our Coronavirus Resource Center. That's where we have a breakdown of all 56 carriers where we're tracking their specific provisions, how they're handling benefits during COVID-19. And then a disclaimer that you can't take any of this as legal advice. And then I'm very pleased to introduce Christina Strong-Reagan. She is our marketing manager, and she's going to help me field any questions that you have today.
Thanks, Jennifer. The one question I did see that came in is, are we able to get a copy of this presentation? I do believe that Kimberly from the Detroit Regional Chamber will provide that to attendees.
Yes, absolutely. I've already sent a PDF version of this presentation over to Kimberly to share with everybody.
Well, we're more than happy to take questions. Jennifer is an expert in compliance. If you do have anything, please feel free to pick her brain right now and put questions in the Q&A box. But in the meantime, Jen, do you have any final thoughts on what the future benefits might look like for the remainder of the year?
Well, we already have, for example, we already have confirmation from Blue Cross, Blue Care Network, Delta, IMED, that regardless how long the national emergency is in place, that they will continue to work with employers so that you can continue coverage for any employees that are furloughed during the entire national emergency. Some of the carriers are requiring that you amend your contracts so that your contract with the carrier spells out exactly what your position is going to be for your furloughed employees during this time.
Well, I don't see any other questions, Jen, so I'm just going to go ahead and let you wrap up and take it away.
Okay, well, thank you everybody so much for joining us today. If you do have any questions arise, please feel free to reach out to us. I'm very happy to help in any way that I can. And I hope you all stay very safe and have a wonderful fall coming upon us soon.
Hi, this is Kimberly from the Chamber. To wrap up today's discussion, I want to say a huge thank you to Jennifer Young from JS Clark Agency, and to all the participants, thank you for your time today. You will soon receive an email from me with a link to today's discussion in case you want to review any of the information that was shared. Please visit our website, detroitchamber.com/COVID-19 for upcoming schedules for Restart Michigan webinars and more valuable information to help your business return to work. Have a great day.
Have a great day. Thank you.